Just a quick update. We are doing a ton of surgery here. We're in the Woodbury, Long Island Surgical Center today. So started the day as I always do, facelift, eyelid lift, a little fat transfer to the face. Came out great. Really natural the way I like it. Now we're doing tummy tucks and breast lifts and breast augmentations, cellulite treatment, all sorts of things. Tons of questions came in last night. So let's just get to a few of the questions this morning and then we'll go into some surgery later on today. One of the questions is, can we do cellulite treatment at the same time as doing liposuction? I often will do cellulite treatment at the same time as lipo. I think it's a great combination. We use something called a cellulase laser for the legs. If you have cellulite, which are those little indentations on the butt, we use something called Avali, and that works to help get rid of a lot of the indentations on the butt. So we can get rid of cellulite at the same time as liposuction. Another question came in about facelifts. Do we address the neck at the same time as doing a facelift? And the answer is absolutely. When we do a facelift, we pull up the neck. So we get rid of the muscular banding that patients have. We get rid of all the extra skin and fat in the lower face as well. So face, neck, all in one, pulled up to the side. Another question came in, where do you make the incisions for a facelift? So what we do with a facelift, we make incisions that start here and then go behind this tragus, behind the cartilage here, then behind the ear, which allow us to gain access in to the face, the mid-face, the lower face, and get the jowls, as well as pull up the neck. So you can expect a really nice, natural look. I think I need a facelift now, too. But it really helps us. Now, can we do eyes at the same time is a question that patients ask all the time. Eyelid lifts at the same time as doing a facelift. This is something that I do all the time. Getting rid of the extra skin in the upper lids, getting rid of the puffiness, and we often, like we just did now on our face and eyes, do a CO2 laser peel to get rid of some of the fine lines and wrinkles and the discoloration of the face. So when you do upper and lower eyelid lifts or facelifts, I often will do a light laser peel. And again, I'm into very natural, so I think that's really important. If you guys have any questions, just ask me. But so we're talking a little bit about facelifts, and I do what also is called the mini facelift often, where I just make a small incision and just pull up the jowl a little bit, and that really helps, and that's a very quick, day or so recovery. Next question that came in, let's talk a little bit about breast reduction, super common procedure, obviously. And when we do breast reductions, we kind of pull everything back up, so lift the breast at the same time as reducing the breast. So we can either reduce the breast, lift the breast, or a combination of those. I'm going to answer a question just came in. If you have any questions, just ask me. I have an issue when I strain my abdomen a lot, get a ripping sensation on my belly button, very strong ripping. Should I be worried about getting lipo with etching? Usually not. It requires somebody who's very experienced. Myself and my partners here at Greenberg Cosmetic Surgery do a ton of lipos. This is all about experience, and this is all about getting a good physical exam. If there's a concern, then I would get a CAT scan like you did, and if there's no hernias, you're fine. I only get hernias. I only get CAT scans on patients before like a liposuction if I'm really concerned. But if you have no problems on CAT scans, safe procedure, easy in-office procedure. If you guys want to come down and see me or my associates, Dr. Weissler, Dr. Ross, Dr. Cooper, at any of our offices, either in New York or New Jersey or Florida or wherever you are, give us a call or go to greenbergcosmeticsurgery.com and you can reach us. If you have any questions, just ask me and I will come on later and answer them. This is Dr. Stephen Greenberg. Have a great morning, everybody. We will come back. I'm about to start another tummy tuck, then lipo, then another upper and lower eyelid lifts, and we'll come back and join you live later. Have a great day.